So this patient had to go through insurance in order to be able to get treatments covered and a diagnosis and MRI and things like that, because it happened at their work. So obviously workman's comp and things like that is involved. And this is where I just get really frustrated with the current medical system. So she ends up going and having a CT scan. Well, so she goes to the urgent care because of the intense neck pain, and they order a CT scan. The CT scan comes back pretty much unremarkable, with the exception of some calcification and a little bit of edema and swelling around the longus colli muscle, which is a muscle that actually runs along kind of the front side of the spine. I ended up taking a look at the imaging, both the report and the hard images, and where the calcification was really high up. It was around the C1 region. So that's basically on the front side, but like basically to get to that area, you know, if you ever had to surgically or for injections, you actually have to go through the mouth. So it is insanely high up there. And so, so she goes and she meets with the spine surgeon, and the spine surgeon does not have the images because there were some technical errors that happened with the imaging, and all he has is the report. So he looks at the report and says, oh, they said that this is likely a tear in longus colli. It's probably not. It's just inflammation and swelling. Doesn't even do any form of physical exam on her. He didn't touch her. He didn't do range of motion, like look down, look up, none of that type of stuff. He simply just said, okay, physical therapy, and we'll see you in 2 months. Nothing. And it is not to his fault. I say that, I don't say that lightly. The system is set up in such a way that he knows that he has to go through physical therapy because that's what the insurance is going to dictate. And that's the punchline of this whole talk that I'm giving here, is that everything gets dictated by insurance in situations like this. But okay, he still could have done a physical exam on her. He still could have made her feel like her pain was important, but she walked out of there thinking that he doesn't give a crap about my pain. It's just checking off the box and going on to the next person, because that's the way it is. They don't have time, they're not getting paid enough, whatever. And it was really discouraging for her as she was kind of going through this.